Hello everyone, welcome to your own channel Complete Nursing Solution by Perfect Professional Services. Today we are going to see a procedure of blood glucose testing. Before moving to the topic, please support our channel by follow and subscribe and share the channel as much as possible and whichever topic you want, please write it down in a comment, so we will be making the videos on those topics. So let's start today's session. Blood glucose testing is a procedure in which a client's blood glucose level is measured using a small portable device called a glucometer. It requires a drop of capillary blood, most commonly obtained from a finger, and takes a few seconds to show results. This is especially important for people with the diabetes mellitus type 1 and type 2, as well as gestational diabetes mellitus GDM. Regular blood glucose testing evaluates the effect of medication, diet, and exercise on keeping blood glucose levels under control. This will prevent future complications like vision impairment, kidney and nerve damage, and cardiovascular diseases. Care point to remember before performing the procedure: be sure to follow your facility policies and protocols. Also, make sure to familiarize yourself with the type of glucometer used at your facility. Determine the most appropriate site for puncture. Your client might have thickened, damaged, edematous, or inflamed area of skin. Check the plan of care to determine how often a client needs their blood glucose checked and what their normal range is. Sometimes you need testing only once a day, while other might need it more than once and at specific times, like before meals or drug administration. Clients who have coagulation disorder or take drugs that can alter bleeding time might take longer to stop the bleeding after the procedure. Articles you need: gloves, Lancet devices, antiseptic swabs, washcloths, cotton or gauze, glucometer and reagent strips. Make sure you read the instruction on how to use the glucometer because some steps might differ depending on the manufacturer. Procedure. Step 1. Make sure your client is comfortably sitting or lying down in a bed in the semi-forward position. If you are in bed, lock the wheels, raise it to the height that comforts to work with, and lower the side rails. Step 2. Take a new reagent strip and place it in the glucometer to activate it. Make sure that reagent strip is not expired or discolored and that it might it it is the right kind of the strip for the glucometer. 3. Prepare the Lancet device, which could be one use or multiple use. In general, you will need to remove the cap of the device and adjust the depth of the puncture depending on the thickness of the client's skin. Step 4. Put the gloves before looking at the best place to puncture. An ideal spot would be the side of the finger. Step 5. Select the puncture side. Avoid the fingertips because they usually have the thickened skin. Also avoid any callus or bruised area and puncture site to prevent previous test. 6. Prepare puncture site. So let's see how you are going to prepare the puncture site. Prepare puncture site. For step 1, warm up the finger with the warm washcloth and hold it below the client's heart level to increase blood flow to the finger. 2. Clean the area with an antiseptic swab. Dry it. 3. Place the tip of the lancet device on the chosen side. Hold it steady and press the button to release the lancet and puncture the skin. After you remove the device, you should see a drop of blood forming. Press gently on the skin next to the puncture site to squeeze out more blood if you need it. Then you have to take the glucometer with the strip and place the tip of the strip to the blood drop. The blood should be automatically drawn in and the glucometer will inform you when enough sample is collected. Step 8. While you wait for a result to appear on the skin, put a cotton ball or gauze square on the puncture side and keep applying pressure until the bleeding stops. Step 9. Read the result and share it with the client and document the result in a medical record. If blood glucose is high or low, immediately report to the doctor. Post-procedure care. After the procedure, watch the puncture site for bleeding. If bleeding does not stop at least 5 minutes after the procedure, inform to the doctor. Observe the puncture site for any abnormalities like discoloration, pain or sensitivity. Thanks for watching. Thank you very much.